Hi, I'm Michelle Rupp, host of AFMC TV. Thank you for joining us. AFMC TV is a place to consider as a healthcare hub. AFMC is a healthcare nonprofit. We specialize in making our lives, businesses, and communities healthy. This space was created to share information with the community. You'll hear from healthcare experts on a broad range of topics. Medical topics like immunizations and telehealth, to lifestyle topics like strengthening a routine or keeping your family hydrated. Our promise to you is to keep you informed in a digital way, providing useful information to you and your family. Again, thank you for joining us and welcome to AFMC TV. About the vaccine. In the next hour, we will
very hard thing.
that this video will provide ideas
And also make sure
Welcome in to this week's edition of AFMC TV. We're so glad you've joined us. We are talking today on a couple of different subjects, but the first one being adverse childhood experiences, also known as ACEs. Do you know what an ACE is? Or maybe what your ACE score might be? Or how about an ACE summit? We're going to answer all those questions with our first guest, Amelia Elam here. Amelia, let's talk about ACEs. Some are familiar with that acronym, some are not. Some know it just simply as adverse childhood experiences. What are we talking about?
Hi, Michelle, and thank you for having me. The adverse childhood experience is just that. It's experiences that children go through while they're growing up. These ACEs, as we call them. The original test was there were 10 ACEs that included neglect, could be physical, could be emotional, abuse, same thing, physical, emotional, but it can also include household challenges such as divorce, death, perhaps a parent or someone you love has been incarcerated, and it's possible there's substance use in the home. So all those do affect the child and growing up.
So we mentioned about an ACE score. What does that mean? Is that a combination of those hardships in your life to come up with a score?
It is. You can look at the score. Originally, like I said, there were 10, but we know there's so many more ACEs than just the original 10. But someone can look at that list of death, divorce, I was abused, my parent was in jail. And if you give them a list of 10 and they have 4 of the 10, it really doesn't define who they are. It just lets them know that they are experiencing issues and that we want to bring awareness to them and get them some help. So the score, while we can talk about a score, we really need to be talking more about how we can become resilient to what we grew up knowing.
So the summit kind of helps to reinforce building that resilience, right?
Yes. And this year's summit, it's our 5th year annual summit, and it's building resilience. So our objective is to learn how to use tools, teach people how to know how to be resilient, how to teach others, because that's what's going to get us through all of these ACEs that we have survived through. It's also going to help those that are in the summit and listening to all these subject matter experts talk to us, people from the judicial system, people from educators. We even have a session for foster parents that we're going to have, so everyone can come. But being resilient will help move them through and become more aware. Awareness is the key. If we're not aware of it, then we're not going to be able to look at these children, and instead of saying what's wrong with them, which if you've got someone out there being a bully or something of that nature, our first tendency is to say, what is wrong with that child? We need to look at that more as to what happened to that child when they were growing up. And if we're more aware of that, then we're going to be more apt to help them and to better our community.
It's reframing and understanding that there's something in the backstory that is causing a reaction and how it's manifesting.
Absolutely. And one of my favorite sayings is everyone has a story, and we're not privy to everyone's story. So we can't look at them and um, judge them or anything, because we do not know what went on behind closed doors as they were growing up.
Well, you mentioned this is the 5th year of the summit. It looks a little different because in years prior, we would all come together, but that's not the case.
Right, not the case. Certainly because of the pandemic, we had come together the first 3 years. Last year was our first virtual that we did in 2 days. And when discussing this year's summit, we thought that, and we know that sitting through webinars for 2 days, that's a lot on a person. So we tossed some things around and thought, okay, we're going to do this as a series. So each Wednesday in September, there's going to be a different summit episode series that people are going to be talking about to the judicial people. We're going to have mental health providers that can talk with someone. Again, the foster parents, teachers, educators. We've got a great list of speakers that are experts at this, and we have worked with them in the past, and we know that what they're going to offer is just going to be some great information and really help us and move us in a direction of that awareness, and better able to understand and make Arkansas as well as our country, so much better when we know this.
That's great. Well, Amelia, thank you very much for joining us this morning. And if you would like more information about the ACES Summit or how you can register, just click the link below. In this week's segment of Catch Up on Your Checkup, we are visiting with Dr. Mary Chatelain of Pinnacle Hearing. We're talking all things ears because hearing, well, I mean, let's face it, you just have to be able to hear. So, Dr. Mary Chatelain, thank you for joining us today.
Thanks so much for having me. I'm so excited to talk to you.
So, all things hearing, there's so much and more probably than what we have time to get into. But I guess, first of all, when is a good time to have our hearing checked?
Well, that's a great question. So if you're not experiencing any hearing loss, we recommend that you have your ears tested by age 50.
Okay.
And so, in the hospital, newborns, they're tested, school-age children are tested. But if you're not experiencing any issues, definitely get your hearing tested by age 50. Since the COVID rise and everyone wearing masks, we have seen such an increase in our appointments because people are really understanding, hey, I think I do have hearing loss. And that's because of these things right here, these masks, because they are covering your mouth. People are not able to lip read. And, most people that lip read, they don't even realize they're doing it. But since the use of mask, people are saying, hey, whenever I don't see people, when I can't see their mouth, I'm having such a hard time understanding. And they're realizing, hey, I do have some hearing loss. So since COVID, really in the past year, we have just seen so many more people coming in due to the understanding issues. One thing that our staff does here, which is really neat, is we have these masks that are clear. So what they do is they actually allow for lip reading. And we've recommended these to school teachers, to people working in the service industry that come across people with hearing loss. So they are able to see their lips. But that is a sign, actually, that you might have hearing loss, is that you have to see somebody to be able to understand them.
You are so right about the masks and some of us struggling. I mean, I probably need to go ahead and make an appointment because I too have realized how much I rely on being able to read lips. So that's a good indicator. What are other contributing factors besides age that would have a reduction in hearing, that we'd begin to see some hearing loss?
So genetics are definitely going to play a factor. So, did your mother, did your father have hearing loss? Another big thing, especially in Arkansas, is going to be noise exposure. So exposure to noise, whether it's loud concerts, music in your car, woodworking, hunting, musicians, things like that are really going to affect hearing. And I would say most people we see, their hearing loss is due to noise, which is preventable.
How is it preventable? What are some of the things we can use?
So mowing the yard, for example, it's something that's pretty common here in Arkansas. We definitely recommend wearing hearing protection when you mow the yard, whether that is inserts, the little foam plugs you can twist in your ear, or the kind that fit over your ears. That is something that here in Arkansas, people are basically going to be doing once a week, but that can really cause lots of noise damage, which is going to affect your hearing. Another thing is with hunting. We know that when you are hunting, you're in the woods listening for animals, it's hard to really wear hearing protection because you are wanting to know what's going on around you. But during those times when you're target practicing, you're shooting your gun and you're not hunting, definitely wearing hearing protection in those situations is really crucial. For musicians, being able to control their environment the most as possible, so there's less reverberation and noise exposure in their environment, but also there are hearing protection musicians can wear. So things like that are preventable, it's huge to just that little bit of effort so it doesn't affect you 5, 10, or 20 years down the road.
What about earbuds? And earpods. What about those devices? I mean, obviously you're going to have them in, but I guess the key would be not to have the volume turned up so loud.
Exactly. So our rule of thumb is, okay, if you're sitting in front of me and you have your earbuds on and I can hear the music, that's too loud. So really monitoring that, you don't want to wear earbuds while you're mowing the yard because then you're going to try to turn that music over the loud noises. So, and with noise-induced hearing loss, what we find is those people usually come in and they say, I don't think I have a hearing issue. I just think everybody else is mumbling. They're the people that are usually brought in by their wife or their children. And the reason is because that type of hearing loss affects the high frequencies. So that affects consonant sounds. Typically, their vowel sounds, they can hear that. And that's where the volume of speech comes from. Consonants is where the understanding comes from. So people that have that noise-induced hearing loss, they typically say, I can hear, I just don't understand. And so they believe it's just because other people are mumbling because they can hear some of what is being said. Those patients are excellent candidates for hearing aids. Typically, we can put hearing aids on those. There are some that have been designed in the past few years that are specifically for people with noise-induced hearing loss, and they do great because it just amplifies those consonant sounds for those that have normal low frequencies.
All right. Well, Dr. Mary, we could talk all day long about this. This has been so insightful and so helpful with the masking and noise prevention and what you can do. Real quickly, let us know where you're located.
So we are located right off Rodney Parham here in Little Rock. We also have a location in Camden, Arkansas, right next to their hospital.
Okay, fantastic. Thank you so much for your time today.
All right. Thank you so much for having me.
Our next catch up on your checkup is with your vision. I mean, we all know how important are our eyes. And as we age, I would suspect our eyeballs age as well. Joining me now is Dr. Julie Dolvin. And Dr. Julie, thank you for joining us today on AFMC TV.
Absolutely.
So you are at James Eye Care out in West Little Rock, and you're an optometrist. So tell us, first of all, when should we be getting our eyes examined? How early in our lives should we be getting our eyes examined?
Great question. We actually recommend children get their very first eye exam between 6 months and a year.
Okay.
So at that point, have that big screening to look for any big things that could harm the long-term ability of the eyes to function well. And then we pick up again about age 2, and then recommend every couple years to have a routine comprehensive health and vision evaluation until once we get over 40, the risk of some medical conditions actually go up. If we become diabetic, we're doing exams more frequently. There's some patients that are on medications that can affect the eyes, and then we may see them once or twice a year as well.
I like what you said about not just a vision test, but also wanting to test for the overall health of our eyes. That is something most of us don't hear about, is the health of our eyes. Talk a little bit about that.
It's actually a lot of people that do not wear glasses, contact lenses, they don't understand or see the value of a health evaluation until they start coming to see us optometrist. And my diabetic patients, their primary care doctors are requiring annual visits. I have personally, as young as 13 years old, diagnosed diabetes through a comprehensive eye exam.
Wow.
I've diagnosed MS several times, and there are just many medical conditions that will manifest in the eye. So I almost feel like we're a gateway to other health professionals.
Yeah.
When we look through the pupil, we can actually, with our light, see the back surface of the eye, the retina. That is the only place in the body we can view arteries and veins, those blood vessels, without any invasive techniques. And so hemorrhages can show up, retinopathy, all kinds of things. Inflammation throughout the eye can be some of the first signs of a rheumatological condition. So
that it really is a look, they say the eyes are a look into the soul, and that's kind of true.
I would agree with that.
So with, we're in the dead of summer, and I don't go anywhere without my sunglasses. And I would hope most people don't too. I mean, especially here in Arkansas, you just have to have sunglasses. Is there a sunglass? Is there something specific we need to be looking for when we're picking up some sunglasses, whether they're fun and funky coming from Target or whether they're high dollar prescription sunglasses? Anything we need to look at there?
Those sunglasses are not regulated. It's not like the FDA is allowing or disallowing certain tags to be on glasses. And so it's very important that you're looking for UVA and UVB protection on those sunglasses. My runners, my tennis players, my bikers, a lot of those, I like for them to have a little wrap around the face because we're protecting from sun, UV, but we're also protecting against that wind. And so you want to have a large frame. So the reasons we would need protection from UVA and B would be cataracts, macular degeneration. The wrap is to make sure that there's no damage from the wind. And then further, a really good quality pair of sunglasses is going to have UV protection front side and back side because the UV rays will actually hit the back side of the glasses and pop right into the eye. So those are important. The larger size is important simply because cancerous lesions, skin cancer can happen right around here very commonly, especially my farmers back here. And the glasses can help to prevent some of that.
Wow, that's incredible. And my last question in these last 30 seconds, we now are in a world where we're virtual, we're on a computer screen, of course we're on our phones. Blue light glasses. Is that a real thing, or is that just a great marketing tool for something that's not necessarily needed?
Sure. It's a great question. There again, some of the glasses that you can buy online or over the counter, not regulated. So we have to take one step back and remember the biggest source of blue light that we are exposed to every single day is that big ball of sun that's outdoors. So adequate sun protection, protecting from UVA and B light, essential. In front of the computers, yes, we are exposed to blue light. However, some of the newer devices and computers went to red diode displays. So we are actually reducing our blue light exposure that way. The LED lights, blue light. So we are getting exposed to it a lot. Blue light glasses, there's about 30 to 35% that we need to be blocking. If we block all blue light, unfortunately, that starts affecting our sleep, our circadian rhythms. So it has to be at a certain percent and only the blue violet rays. So those things are definitely put into prescription glasses very adequately and correctly. Now, I do get a lot of patients, whether it be placebo or not, I bought these offline and they're blue light and they help me. Perfect. They're not probably hurting you at all. But getting the ones with adequate protection, definitely I have seen improvement with my patients. But I'm also telling them 20, 20, 20. Every 20 minutes, take 20 seconds, look 20 feet away. So there's definitely something to it, but I think technology is moving away from blue light exposure and not forgetting those sunglasses.
Awesome. 20, 20, 20. That's the takeaway. Dr. Julie, thank you so much for your time today. We appreciate it.
You're welcome.
And thank you so much for joining us. We look forward to seeing you back here next Wednesday for more AFMC TV.